Hi, Fred Page. I'm here to do my head, ears, eyes, nose, and throat examination. I'm going to start by introducing myself. Hi, my name is Fred Page. I'm the nurse practitioner who's going to be your examination for your head, eyes, ears, and nose and throat today. Okay?
Okay.
You have any questions?
No.
Okay. Alrighty, I'm going to start with doing the inspection of the skin, and I'm examining both arms as well as the legs. And then I'm going to go to start with temperature. The temperature on both arms is warm and dry, and legs is also warm and dry. And the tugger, I'm going to test the tugger. Is pinch. It's non-tinting. Going back down. And with that, I'm going to do with the texture. The texture on this arm is smooth. The texture on this arm is smooth. And this leg is smooth, as well as smooth on this leg. Then I'm going to move into my hair inspection. His hair is examining the texture, as well as the distribution, as well as the any presence of any parasites, lesions, or masses. I don't see any of the such. I'm examining both sides of his hair. And also to the quantity. His quantity, there's no hair missing at all. It's evenly distributed across his head. Then I'm going to go into the nails. Hold your hand out there like that, please. Just rest them down. His nails, I'm expecting them first. Upon inspecting the nails, I'm moving to seeing there's no clubbing of any fingers. Checking all fingers on this hand, left hand, and then the right hand. There's no presence of clubbing. And then I'm going to do the capillary refill. Capillary refill on this hand, each finger. It's less than 3 seconds. That's the left hand. Tested all 10 fingers. Capillary refill is less than 3 seconds on all fingers. Then I'm going to, far as the color, the texture, and the consistency of the nails, it's all consistent throughout both hands. Then I'm going to move into the hair, nails. Okay. Then I'm going to move into the head. I'm going to palpate the head and scalp. Therefore, I'm going to have you stand up, please. And we're going to turn the chair. Yes, sit down, please. And then I'm going to palpate the head, and then I'm gonna move to the scalp, back of the head, and then I'm going to, you let me know, I'm going to press on the side of the front of your face where your sinuses are. Let me know if you have any pain or tenderness. Palpate the frontal and maxillary sinuses, tapping. Any tenderness or any pain that you feel when I do that? Okay, all right. Tapping that, okay. Then next I'm going to move to the palpation of the temporal arteries. Temporal arteries are right here. It's going to palpate there. And then next I will auscultate those. Take time to palpate and auscultate both sides of the temporal arteries. Temporal arteries are here, palpating. Follow up with the, then like I said, auscultation. And then next I'm going to inspect the neck. I'm going to inspect the neck as well as the neck veins. And then I'm going to move into the palpation of the neck. I'm going to do I do it from the front, the back, the trachea, yeah, it's midline there. And then I move back to the thyroid. Thyroid is here, palpating thyroid here, down a little farther, palpating the thyroid. And then I'm going to move over to the lymph nodes. I'm going to start with the lymph nodes. The preauricular is before the ear, and the posterior auricular is going to be behind the ear. And then I move down to the tonsillary, and the submillary, and then the submental is under the chin. And then I move down to the anterior cervical. And then deep cervical, you actually have to turn your head when you look that way, please. Deep cervical is deep, so it's sometimes present when the patient turn their head. Have you turn back looking at this for me, please? And then you go to the posterior auricular. The anterior is here, and the posterior cervical, anterior cervical is here in the front, and then the posterior cervical is in the back. And then the supraclavicular is going to be right here above the clavicle. So that's the supraclavicular lymph node. And then all right, did all the lymph nodes. And then I move over to the eyes. I do the inspection of the eyes. I'm going to inspect his eyebrows here, and the eyelashes, as well as the eyelids and the lacrimal gland and the orbital areas. I'm just doing inspection first, and then I'm going to move into the palpation of the orbital areas. I'm going to take his eyes, look up for me please. And looking at the conjunctiva is pink and the sclera is white. I am that as well. The palpation of these areas, of the orbital areas. And then I'm going to move into my testing for the direct consensual response. So when I'm doing that, I'm going to examine his right eye. So I'm going to look, step back, and I'm gonna look until I find it. I'm gonna start with the left eye. Left eye there. I'm going to, until I find the red, and I'm going to move in, examine the eye, and get the red response. And I move there. Okay. And then I would do the same with the opposite eye. I would look at the left eye with that eye, and then I would do the right eye. The right eye, same thing. Move in. Okay. And then I'm going to do my red reflex. Is to where I'm going to use the ophthalmoscope as well, and I'm going to shine the light into his pupil. And what it's going to do is going to follow all the way and to the person's eye. And basically what it is going to actually, it constricts looking into the left eye, and then constrict with and then the second is going to constrict with the eye that I'm examining, which is the left eye. And over here, I'm going to shine the light, and it actually constricts that eye. And then the second shining is going to constrict the eye that's been examined, which is going to be his right eye. Then next, I'm going to move over to the ears. I'm going to start with the inspection of the ears. I'm going to start with the placement of the ears as well as the external canals. I'm going to see if there's any pain or tenderness or anything like that, or any drainage that's being present on the external canals. And then I'm going to occlude one ear, or I'm going to ask you to occlude this ear. Just take your finger and do like this. And I'm going to whisper a word. I want you to see if you hear that word. Same thing with this ear. Okay, all right, did that. And I'm going to do the tug test before I actually pull down on the penna, before I insert my otoscope. I'm going to pull. Let me know if there's any pain or tenderness that you feel.
No.
Okay, tested both. So I'm going to switch over to my otoscope. And I have the largest tip on here to examine the ears. So what I'm going to do, I'm going to pull up and then back. And so therefore I'm going to examine here his right ear. And I'm going to use my right hand. I'm going to provide support with my thumb. I hold like I'm holding a pen. So as I get closer, examine his going in. And I'm looking to examine the tympanic membrane and make sure there's no redness or bulging or drainage present upon looking in the ear, and none is present. And I'm gonna go over here, the same thing. I'm going to, looking into the left ear, I'm going to support it with my left hand, and I'm going to continue to insert it and support it against his face until I actually look and I discover the tympanic membrane. And I'm examining for any drainage, any redness or bulging in the ear, and none is present. Next, I'm going to do the inspection of the nose. I'm going to inspect first. I'm going to inspect for shape, symmetry, and any deformity, and as well as any swelling or edema that's present outside the nose, and I don't see any. So therefore, I'm going to ask the patient to first, before I examine the inside of his nose, I'm going to ask him to blow his nose. Okay. And then I'm going to take my otoscope. I'm going to examine. I'm going to have you tilt your head back, and then I'm going to take my thumb and I'm going to examine looking for the turbinates, looking for any presence of lesions, any redness or bulging. I'm going to look into both nares, the same thing, looking the nasal septum for consistency, and I'm going to look at the nasal cavity for patency. And I'm looking for a presence of any irritation, any redness, or anything like that with the turbinates, as well as the nasal cavity and nasal septum, as I said, for consistency and patency, and none is present. Then I'm going to move over to look, as well as I'm going to examine the nose, the mucosa, as well as examine the turbinates and the nares. So those are the three things that I'm going to be examining inside of his nose: the nares, the turbinates, and the mucosa. And no redness or discharge or edema is present right now. And like I said, the nasal cavity is examining for patency, which is present, and as well as the nasal septum is for consistency. Then I'm going to move over to the mouth. I'm going to examine the mouth. First, I'm going to do inspection. The mouth, the lips, there's no cracking, there's no sores present or no lesions. So therefore, I'm going to ask him to say ah. And I'm actually going to shine the light inside, and I'm examining the back. Stick your tongue out for me. I'm examining the teeth, the buccal-mucosa, as I'm shiny looking around. Examine the teeth, the buccal-mucosa, as well as the tongue. Stick your tongue out. The tongue is pink and shiny in color, and as well as there's no redness or any type of inflammation or anything like that inside the mouth. So next I'm going to examine the floor of the mouth. So I want to ask you to stick your tongue to the roof of your mouth, and I'm examining the bottom of the floor of the mouth under the tongue. And you can close your mouth now. That concludes my assessment of my head, ears, eyes, and nose and throat. Thank you.